In a bid to tackle neglected tropical diseases, Leprosy Mission Nigeria has inaugurated a groundbreaking project in Benue, Nasarawa and Zamfara states. The initiative, supported by the Leprosy Mission Australia and the Australian government's Department of Foreign Affairs and Trade, aims to eliminate diseases like leprosy, Buruli ulcers and lymphatic filariasis in 12 endemic communities. Let's join Elizabeth Kasham for more.
The National Coordinator, Leprosy Mission Nigeria, Dr. Sunday Udo, speaking during the launch, said these diseases not only cause physical suffering but also perpetuate stigma, hindering access to healthcare, social inclusion and economic opportunities. He is optimistic that people affected by leprosy will soon gain access to medication as arrangements have reached their final stage.
And we trust that before the end of the year, that the drugs will come. That there are a lot of talk around it, a lot of advocacy. In fact, even up to the UN rapporteur for persons affected by leprosy has been involved in this conversation. So we believe that before the end of the year, the drugs will come, because it's a serious issue that we find cases and we can't treat them. And to also know that there are children involved, it makes it even more painful. But we trust that as they have started, before the year runs out, the drugs will come.
Member, Board of Leprosy Mission Global Fellowship, Professor Ekanem Itibre, praised the long-standing efforts of Leprosy Mission Australia, stressing that the project is vital to Nigeria as it's directly impacting people in rural communities.
And what they can learn from this is that this is a strategy that will work, that works. Going down to the communities and making them own the problems and making them also profile solutions and making them aware about what they should do in finding cases and in preventing leprosy. And also government should equip the frontline health facilities properly.
International Program Manager, the Leprosy Mission Australia, Andrew Newmarch, says the mission takes decisions regarding allocations but expressed satisfaction with the judicious use of the allocated funds to the Leprosy Mission in Nigeria.
And I think the reason that we've got this project starting now is because we've seen evidence that there's been effective use of the funds and impact that's been in the Zamfara state. And so we feel confident that continued activity will also have an impact. And so we are really hoping that that will be the case, and we look forward to continued collaboration with our partners in Leprosy Mission Nigeria.
One of the project's key strategies also involves donating mobile clinic model to enhance healthcare access in remote communities, which include tricycles equipped with medical services and local volunteers to help bridge the gap in healthcare delivery. Elizabeth Kasham, ASO Television News.